Welcome to SPRC's State Infrastructure Success Stories. I'm Julie Eben with the Suicide Prevention Resource Center, and today I'm speaking with Sarah Brummett, Colorado's Office of Suicide Prevention Director. Hi, Sarah. It's nice to be here with you today.
Good to be with you. Thanks for having me.
So, Sarah, can you paint a picture for me of what Colorado's suicide prevention funding and staffing looked like 5 to 10 years ago versus today?
Our office has been around for 20 years, and when we were first
Wow.
created as an entity, we had about 2 FTE, about $200,000.
Wow.
And that was a great success to even have that codified in statute. The next fiscal year will be a team of 7 FTE, which is amazing.
Wow.
And the goal is that we'll start to build a similar infrastructure at the local level, because that's really where suicide prevention happens. Our job is to get the funding and resources, draw them down, and get them to communities.
How have you been able to expand funding from then until now?
It's been having key advocates, in the private sector who are able to move a little bit more nimbly and really take a stronger stance in the legislative process than we can as government employees.
Mm-hmm.
And then there's also some really strong champions in our legislature that we've enjoyed. We've also been really successful in drawing down several of the federal grants that are available to support suicide prevention. So, I really think that's due to a lot of the infrastructure that exists here in Colorado and our ability to plug in and leverage other departments and programs and organizations. The other programs that we have in our branch include overdose prevention, child maltreatment prevention, all sorts of other issues that, if we're looking more systemically, share a ton of common protective factors. And so we've committed as a branch to really trying to pool and leverage our resources in that upstream space.
How has some of the infrastructure that you've put in place helped you to potentially attract new funding?
We are able to partner very closely with our Office of Vital Statistics, and they've been able to pool data together so that we built a visual data mapping tool. And I think that's been very helpful for our federal funders who want to be able to see in a very visual way what the issue looks like in a community. And you can click on your county or the specific demographic you're interested in to really start to pinpoint where the greatest opportunities are for prevention. I think that's been really helpful for us in terms of drawing down funding and being able to tell the story. And we've also heard that it's been really helpful for our local partners to draw down foundation and private dollars to help with their suicide prevention efforts as well because of that data.
How have the SPRC state infrastructure recommendations helped you in Colorado?
Not only is it really reinforcing and validating to how our state has set things up, I believe that every county or city, or however you define community, should also have a dedicated resource hub for suicide prevention. So that's one way where we can take those recommendations and kind of mirror them at the local level and really invest in suicide prevention at that community level. So I think they've been really helpful that way. And also telling the story to our decision makers around, Colorado is following these recommendations in these areas. Maybe not all of them, but here's things that we're doing well as a state. Suicide is not just a mental health issue. That can be a piece of it, but there's so much more that drives human despair, and really trying to see it as, what are all the ways that make us hurt? And that is also what we need to be focusing on as well, and really taking an eye towards building and supporting communities that are worth living in, and really improving lives, just not just keeping people alive.